So the next question is, what are the causes of valvular heart disease? What really causes valvular heart diseases, doctor? You said like few of the causes, like this might lead to this disease or something, but in major, what are the types of valvular disease, and what are the real causes of valvular disease, doctor? Can you please elaborate briefly on that?
Sure. So, valvular heart disease are very common in our country and throughout the world also. And most common cause is rheumatic heart disease. So, what is rheumatic heart disease? It's very prevalent in our country, and this is one of the most common cause of the valvular heart disease in our country overall. So, in this disease, there is inflammation of the joints in early childhood. When the baby is around 2 to 5 year old or around 5 to 6 year old, there is a recurrent sore throat which initiate inflammatory response in our body. This inflammatory response initially makes the joints swollen, and child tells about the pain and there is swelling in the joint, mostly knee joints, and other joints are also involved. So, and if the inflammation is recurrent, the child is suffering from recurrent sore throat and inflammatory joint pain. These inflammation finally makes the heart also inflamed. The lining of the heart, the muscle of the heart, inner lining, muscle, everything becomes inflamed. That is called pancarditis. Heart becomes inflamed. Once the heart is inflamed, the valves are also inflamed, and recurrent repeated valvular inflammation leads to damage to the heart, and this leads to the rheumatic heart disease, rheumatic valvular disease. Another is congenital valvular heart disease. Many of the times child is born with less or more leaflets in the valves, and the valve is diseased, it's not closing properly, or it's not able to hold the blood, and valve becomes regurgitant or stenotic. Either it's not opening properly or it's not closing properly. When the valve does not open properly, it's called stenosis. The area of the valve becomes less, and when valve is not shutting properly, closing properly, it leads to leakage of the blood, and this is called valve regurgitation. So, top cause of the valvular heart disease is rheumatic. Another causes are also there. Second is the ischemic. When somebody suffers from a heart attack, there is damage to the heart, and this damage extends to the valve, and valve becomes leaky. And next is the dilated cardiomyopathy, where heart dilates and the valve becomes leaky. Other is connective tissue disorder. There is disorder of the muscle and joint, where the valve is also diseased. Another is Kārcinoid syndrome. But there are many, but most common and most of the valvular heart disease is either due to rheumatic heart disease, or some congenital heart disease, some degenerative heart disease due to aging process, and other is ischemic and non-ischemic cardiomyopathy, and lesser common are the connective tissue disorder or rheumatoid diseases and Kārcinoid syndrome. So these are many infection, even direct infection to the valve, infective endocarditis can be damaging to the heart valves and leads to the valvular heart disease. So these are grossly causes of the valvular heart disease. So valve can be damaged by different mechanism, and most common in our country is rheumatic heart disease. And mostly the age group of the different type of valve disease is different. So these are the common causes of the valve disease.